Hello everyone, today I'll be showing you how to do an intestinal end-to-end anastomosis. Now this technique is a little bit different, I'll be doing it on chicken intestines, and this may not be for the light-hearted people, so viewer discretion is advised. So first off, we begin, we can see that the intestines are connected, they have got the blood supply, and there is the omentum which carries the blood vessel to the intestine. So we isolated the blood supply of the intestinal portion we want to resect. And we pass the thread, and we have sort of like are doing an instrument tie to block the blood supply. So once we cut, there's no bleeding. In a live patient, there's going to be bleeding, so we prevent that by blocking that vessel. So once we do the cut, now we can successfully cut off the distal end, and we've got the free end of the intestine. Now we place the two ends of the intestine, we mark the area, we sort of like hold the ends together with a locking scissor, and we cut the ends of the intestine. So in real case, we would be very careful about the margins, how far the tissue is, especially if you're cutting off lesion with malignancy. Now we've got the two ends, and so we're gonna join the two ends. So we've got two sides. One is the side of the omentum. So this is the side of the omentum. We're passing the needle extramucosally through one end, and we're passing the same needle extramucosally through the other end. Now the idea is we are going to approximate the two ends. We're going to tie the thread, and we're going to remember the orientation of the intestine by closing the loop, by sort of like holding the two threads with a curved forceps. Now this is a extramucosal technique. There are intramucosal techniques as well. You involve the mucosa in that case, and which is a little bit faster. This one has better results, if it's done properly extramucosally. And then on the opposite side, for the next step, we basically pass the thread through the opposite end of the layer of the intestine that was attached to the omentum. So this is the other border, which is opposite to the first one, and so we pass the thread extramucosally. We don't tie it, and we hold the threads with a needle holder. Now we're going to start with the continuous suture. We also have the option of doing an interrupted one. Again, we're moving extramucosally through the two layers of the intestine. Now this intestine is a little bit small considering it's chickens, and the way I acquired it was a pretty funny story. People wouldn't believe it. Why would I actually want to buy this thing? They usually throw it away. and actually I was looking for a goat or a cow's intestine, but somehow I got it eventually, despite getting the looks. So we take the bites again. The whole thread should run extramucosally, which would have been much easier in case of a cow or intestine. But here we just follow the process for the purpose of illustration. So we run the thread, separate about 2 to 3 millimeters, and you want to make sure that there is no gap because there is a high incidence of leakage. So we continue this process multiple times, closing the front portion, the portion which is linked to which is visible. Notice the behind portion of the two approximated intestine is still open. So now there's something interesting which I'm going to show you, which is one of the ways you can orient your needle. So we left the threads which we used as a guide for the lower border of the intestine open. So what we're going to do is we're going to sort of open the holding scissors and pass the needle through. So pass the needle through the opening of the threads held by the scissor. Now once we open it, we can tie it. We do an instrument tie. And once we're done with that, we can lock it with square knot and repeat the process. So these threads are very important to reorient the intestine so that we can expose the back of the opening. So what we're going to do is we're going to pass the one forceps behind and the lower half of the threads behind, hold it with the forceps, and now we've got the back end exposed with the intestine twisting on itself, and we are reoriented. Now it's very important to pass the needle from behind so that it loops correctly, and we can continue our continuous suture. Now once we pass the thread through the two openings, again we're making it extramucosal. We want to make sure that it's fully closed, and if there is an opening where there is a potential leak, especially around the edges, then we can reinforce it with an interrupted suture. We can also reinforce this anastomosis with Lambert's stitch. So now we have reached almost at the end. We can close off this continuous suture using the remaining pieces of thread, which is used for orientation inside, held by the tooth, by the curved forceps. So we pass one, and now we're done. Almost done. Alright. So this is an extramucosal anastomosis of intestine. we are going to close it with the simple instrument tie. You can see the ends of anastomosis. Final view. Now you know how to do end-to-end intestinal anastomosis.